This is Dr. Goel, SM Goel, MD Medicine and DM, bought from India, Delhi, and also I did my MD and DM in US. Today I'm going to talk about making a video on heart failure. Heart failure is more like a symptom actually, and what it means ki heart is not able to pump enough blood, sufficient blood, which is the main function of the heart, to contract and relax. When it relaxes, it fills up with the blood, and when it contracts, it pushes the blood all over the body. And it goes to body and then it goes to lungs also, where it cleans and comes back to the heart, and then it goes to rest of the body. So, and it doesn't empty completely. I mean, if blood pressure is maintaining, contracting and relaxing, which we all know about 120 upper number and 80 lower number, 120 over 80, and it pumps out about 60 to 70% of the blood, which we call the ejection fraction. So when the heart fails, it can fail. Suppose we have high blood pressure for a long time and we develop, heart arteries start getting increasingly blocked because of the cholesterol, and we have a heart attack. So in such a situation, heart muscle, while we recovers, but it becomes weak. Part of the heart muscles become weak and not able to pump blood effectively. And really, when it's not able to pump more than it pumps only like 40 to 50%. In such a situation, we start developing heart failure. And so, like I said, the high blood pressure for years and years can lead to heart failure eventually. Also, sometimes the heart walls, they make sure the heart flows only in one direction. Sometimes they become not as effective and blood goes back, and that also eventually, unless we manage, it leads to the heart failure. And sometimes we may not have a major heart attack, but small heart attacks, because of the coronary heart artery conditions, or for the high cholesterol blockage. So in such a situation, hearts, eventually leads to the heart failure. And high blood pressure is very important for years and years. We really need to manage them. Eventually, it will lead to heart failure. You see. How can we diagnose heart failure? Well, we do the ultrasound of the heart, which is a very simple and very effective test. It tells us that heart is only ejecting. Not ejecting, normal, ejecting only 40%, 50%, and it will tell us about the heart failure. We can look at the ECG also. It will tell us we see changes because of the high blood pressure or any heart attack in the ECG. We should do blood tests. Blood tests are very helpful. Both, we need to make sure there are not any major abnormalities in the blood test. So what should we do? We should definitely do everything from day one to stay healthy. We should sleep well, get enough sleep, which is very important for heart also. Smoking is very detrimental to the heart, so we should not smoke or try everything to quit it. And exercise regularly, Also, if blood pressure is high, we should definitely manage it, because it will break the vicious cycle of eventually leading to the heart failure. Same thing with the diabetes. High blood sugar and high blood pressure are detrimental to the heart. Diabetes leads to the very increased amount of cholesterol. So we manage diabetes. And we obviously manage, as soon as we manage, we don't have to worry about high cholesterol. If there is any increased fluid in the body, we give water pills to get rid of the increased body. That makes heart comfortable, able to pump blood. And And then sometimes, so we can use a pacemaker to maintain a normal rhythm of the heart. And definitely we should use medications to maintain normal blood pressure, and also medicines to support our heart. And obviously we need a constant care by our physician, so we should make sure that we follow with the physician regularly and do our follow our instructions, take our medicines regularly. And as I said, this is what we need to do, and we need to do from the young age. We should um, be educated and educate ourselves how to stay healthy, especially in relation to our heart. Thank you so much.